Good morning, Mr. Ray. How are you?
Good, how are you?
Good. I'm Kiara. I'm going to be your provider today. I'm going to go ahead and wash my hands and get started. We're going to close the curtain and we'll begin your exam. Is that okay?
Yep.
Alrighty. So I'm washing my hands. Curtain is pulled. I wanted to ask you, is there a reason that you're in the office today?
Just a checkup.
Just to check up. Okay. Well, we're going to get started. I'm going to start with your eyes in just a moment. Okay. So what I'm looking for is just any redness or swelling. Have you had any visual problems?
No.
Wear glasses?
No.
All right, so the external of his eye, there's no swelling present, no droop on either side. His conjunctivae are pink and moist. There's no irritation present. I'm going to use my light and shine it in your eye. All right, so look towards me, please. Thank you. All right. They are equal on both sides. I'm also going to have you follow my finger from each side. And then it's going to come closer towards you, okay? Just follow it towards me. Thank you. Alrighty, so they are equally reactive and they track well, okay? So next I'm going to begin by looking inside of your mouth. I'm going to use this tongue decompressor and press down on your tongue. I would like for you to say, ah, as I do that, okay?
Okay.
Thank you. All right, so there is no redness. His uvula is midline as he says ah. It does not stay to one side. Dentation looks good. There's no cavities, no problems with your teeth. Mucosa is moist and everything inside the mouth looks good, okay? Next I'm going to move into your neck portion. Here I'm going to be palpating your carotid arteries, so I'm just going to palpate one at a time. His pulse is 3+ on each side. Okay. Now I'm going to go ahead and listen to your carotid arteries. Here I'm listening for any bruits. For negative for bruise on both sides. All right, next I'm going to palpate your neck, which just means that I'm going to feel. I'm feeling for any lymph nodes, which are not typically palpable on a regular adult that's not sick or having any illness. So if you could sit straight up for me. All right, I'm going to actually move towards the back before I begin palpating. You don't have to lean back too far. All right, so first I'm going to go ahead and palpate your submental lymph nodes, which are not palpable. Submandibular lymph nodes. Right, I'm moving into your tonsillar lymph nodes, which are also not palpable. Your preauricular lymph nodes. Postauricular lymph nodes. Your anterior cervical chain. Just going to kind of roll down your neck. And then your posterior cervical chain. Your occipital lymph nodes, which are right here at the base of your neck, which are not palpable either. And then I'm going to have you bend your shoulders forward for me. Yep, just like that. I'm going to palpate right here, just a little bit deeper. And your lymph nodes here are not palpable. If you could scoot back just a little bit towards me. Thank you. I'm going to palpate your thyroid gland, which is not typically palpable or visible on a normal adult. First, I'm going to have my hand right here and I'm going to ask you to swallow. Okay, so I found this notch. I'm going to also displace your thyroid. So I'm going to push it to one side and feel with my other. If you will look towards my right side or your right side, thank you. Here I'm palpating for any nodules or enlargement of the thyroid, which are not present. And I'm going to do the same thing to the other side, okay? So I'm displacing it and thank you. Nodules or enlargement are not present, so the thyroid's not palpable. Perfect. You can look forward. Thank you. Next, I'm going to move into listening to your back while I'm back here and percussing your back. Is that okay with you?
Mm-hmm.
For the purpose of this exam, I may have you shift to the side, so if you could shift so that the camera would be able to see you. Alrighty, so shift just a little bit, sorry. And just sit straight, thank you. Alright, so first I'm going to begin by percussing your back. So I'm going to start here at the top. Okay, thank you. Resonant sound is heard all over the back portion of the back. I'm going to listen with my stethoscope now. I'm just listening to breath sounds. Listening at the base of the lungs. Okay, breath sounds on both sides are clear. There are no wheezing or crackles present. Okay, so you can turn towards me. Okay, all right, I'm going to listen to your chest as well. So first I'm going to start by listening to your breath sounds, and then I'll move into listening to your heart. Does that sound okay?
Yep.
Okay. Breath sounds on both sides are cleared. There are no crackles or wheezing present. Okay, so I'm going to move into listening to your chest. Is that okay with you? All right. First, I'm going to be starting by listening to your aortic valve. Your pulmonic valve. Be listening over Erb's point here. Moving down to your tricuspid valve. And then moving over to your mitral valve. S1 and S2 are heard, no gallops, no clicking, and no murmurs are present. Okay, next I'm going to move into the abdominal portion of the exam, if you're okay to lay down for me. Are you comfortable?
Mm-hmm.
First, I'm going to begin by listening to your abdomen. I'm also looking over your belly, making sure there's no scars and that the contour of the belly looks normal and that the skin looks normal. All of it looks good. There's no rigidity. Okay, No scars present. Let me go ahead and begin by listening in each quadrant. I'm also listening to your aorta. Okay. Clicks are present in the abdomen, and the aorta is 3+ with no bruit present. Okay, so next I'm going to go ahead and percuss your abdomen. So I'm going to percuss over each quadrant. If it hurts, just let me know. Percussing over the liver's edge as well. Resonant sound is heard over all quadrants and over the liver's edge. Okay, so next I'm going to palpate your abdomen, and I'm going to begin over here. Let me know if there's any pain, okay?
Okay.
Okay, so this is going to begin with light palpation. I'm just palpating for any kind of mass or anything like that. Okay. No pain.
Mm-hmm.
Okay. Okay. There are no palpable masses and no pain present in the abdominal quadrants. Next, I'm going to move on to deep palpation. This is going to require me to kind of brace myself on the back side of your back, okay?
Okay.
Okay. There we go. Alright, so this is a little bit deeper. So I'm just kind of pushing back there. And move to this side and do the same. No pain present.
No.
Okay. And then over to this side. Okay. There are no palpable masses present and no pain. You can sit up on the edge of the bed for me. All right, Mr. Ray, is there any questions that you have about your exam today?
No.
Okay. Well, it was nice to meet you, and I hope to see you again, okay?
Thank you.